Hello, welcome to my channel Vital Sphere. Today, it will be about a true story of pneumonia and death. The life and legacy of Cokie Roberts. Cokie Roberts was a household name. An esteemed journalist and political commentator, Roberts spent decades at the forefront of American media. She had earned the trust of millions with her insightful analysis and poised delivery. But in 2018, just 1 year before her untimely death, Roberts found herself facing the harsh reality of a health crisis that would ultimately take her life. What started as a routine battle with pneumonia turned into a fight for survival that, tragically, she lost. Her death from pneumonia at the age of 75 highlighted the vulnerability of even the most accomplished individuals to the deadly effects of an infection that often goes unnoticed. Pneumonia, particularly in the elderly or those with compromised immune systems, can swiftly progress from a mild illness to a fatal condition. Through Robert's story, we gain a deeper understanding of the power of pneumonia and how it can strike at any moment, even when the body seems otherwise strong. Cokie Roberts' early life and career. Born Mary Martha Corrine Morrison Claiborne Boggs in 1943, Cokie Roberts came from a family deeply rooted in American politics. Her father, Hale Boggs, was a prominent Democratic congressman, and her mother, Lindy Boggs, served as a U.S. representative from Louisiana. Cokie grew up surrounded by power and influence, but her path to fame would take a different route into the world of journalism. Roberts attended Wellesley College and, after graduation, began her career in media. She initially worked for local radio and television stations before becoming a reporter for NPR in the 1970s. Her break came when she became a congressional correspondent, covering Capitol Hill for NPR's radio programs. She was one of the first women to gain significant recognition in a male-dominated field, setting the stage for a remarkable career that would span over 4 decades. Throughout the 1980s and 1990 seconds, Roberts became a familiar voice on NPR, ABC, and PBS, offering political analysis and commentary that was both insightful and accessible. She co-hosted NPR's Morning Edition and appeared regularly on This Week, ABC's Sunday morning political show. In addition to her journalistic work, she authored several books and remained a passionate advocate for women in media. By the time Roberts was in her 60s, she had become one of the most respected and recognized journalists in the United States. Her reputation as a fair, thoughtful commentator earned her numerous accolades, including multiple Emmy Awards. Her reporting on the most critical political events of the era, from presidential campaigns to international crises, earned her the respect of both her peers and the public. However, her greatest legacy wasn't just her work, it was the impact she had on the people who listened to her, trusted her, and learned from her insights. Health struggles before pneumonia. As her career reached its pinnacle, Cokie Roberts' health began to take a toll. In the early 2000s, she was diagnosed with breast cancer. The diagnosis shook her, but Roberts, known for her resilience, faced it head-on. She underwent surgery and treatment, and after a period of recovery, she returned to work. Though she had won the fight against cancer, the experience left her more aware of the fragility of life. In the years following her cancer treatment, Roberts continued to be active in her career, but she began to feel the effects of aging. She had heart issues and some problems with her immune system, which left her more vulnerable to infections. Pneumonia, which can develop as a complication from other illnesses or even after routine respiratory infections, was an ever-present concern. Roberts, like many in her age group, was aware of the risks associated with pneumonia. Her doctors monitored her health carefully, but as her immune system weakened, they knew that any respiratory illness could become a serious problem. By 2018, Roberts had experienced a series of minor health issues, but she was still engaged in her work, attending events, and maintaining her role as a respected commentator. Then, in the early fall of 2019, Roberts started to feel unwell. It began as a mild cough and fatigue, but soon progressed into something more serious, the onset of pneumonia in September 2019. Roberts was hospitalized for pneumonia. At first, her family believed it was another minor illness that could be managed with medication. However, as her symptoms worsened, extreme fatigue, difficulty breathing, and severe coughing, doctors were concerned that her pneumonia was severe and might escalate. She was placed under intensive care as her lungs struggled to supply her body with the oxygen it needed. At the time, her family and friends were hopeful that the antibiotics and other treatments would be effective, and that Roberts would soon be back to her old self. But as the days passed, the situation grew direr. Pneumonia, a respiratory infection that inflames the air sacs in the lungs, can lead to severe complications if not treated quickly. In Roberts' case, the infection overwhelmed her already weakened body. She remained in the hospital for several days, surrounded by her loved ones. Her health continued to deteriorate, and her medical team tried every possible intervention. But the damage caused by pneumonia, combined with the other health issues she had been battling for years, proved too much for her body to handle. On September 17, 2019, Cokie Roberts passed away. The cause of death was complications related to pneumonia, a disease that many considered a common cold gone wrong. Her family, colleagues, and fans around the world were shocked by her passing. The medical facts about pneumonia is often underestimated, and many people are unaware of how dangerous it can be, especially for older adults, individuals with weakened immune systems, and those with chronic health conditions like cancer or heart disease. In fact, pneumonia is a leading cause of death among the elderly, responsible for more than 50,000 deaths annually in the United States alone. Pneumonia can be caused by various pathogens, including bacteria, viruses, fungi, and even certain medications. The most common form is bacterial pneumonia, which can occur after a viral infection like the flu. It causes the alveoli air sacs in the lungs to become inflamed and filled with fluid or pus, making it difficult for the body to take in oxygen. Symptoms of pneumonia can vary, but they typically include cough, chest pain, fever, chills, difficulty breathing, and fatigue. In more severe cases, pneumonia can cause respiratory failure, septic shock, and death. This is particularly true when the body is already compromised by other illnesses, as was the case with Roberts. Treatment for pneumonia often involves antibiotics for bacterial cases, antiviral medications for viral infections, and supportive care such as oxygen therapy. However, in severe cases, patients may require mechanical ventilation or hospitalization in intensive care units. Cokie Roberts' decline and passing. As her pneumonia worsened, Cokie Roberts' family remained by her side. Her husband, Stephen Roberts, a fellow journalist, and their two children, Lee and Rebecca, kept a vigil in the hospital, praying for a recovery that would never come. They understood that the infection had taken a firm hold, and with each passing day, the chances of her survival dwindled. Her death was not only a personal loss for her family but a huge blow to the journalistic community. Cokie Roberts had been a pioneering figure in American media, and her voice had been an anchor during times of political turmoil and national crisis. News of her death spread quickly, with tributes flooding in from colleagues, friends, and admirers. In the days following her death, public figures like former President Bill Clinton, ABC anchor George Stephanopoulos, and former NPR President Vivian Schiller praised her work and expressed deep sorrow at her passing. Her legacy as a trailblazer for women in journalism, as well as her integrity and thoughtful approach to political reporting, would never be forgotten. The impact of pneumonia on society. Pneumonia remains one of the most significant public health threats, particularly to older adults. Globally, pneumonia accounts for millions of deaths each year, making it the deadliest infectious disease. Despite advancements in medicine, pneumonia continues to be a leading cause of mortality, particularly among vulnerable populations. Preventing pneumonia involves vaccination, particularly the pneumococcal vaccine, which protects against some of the most common bacterial causes of pneumonia. People over the age of 65, as well as those with chronic illnesses, should be vaccinated against pneumonia to reduce their risk of infection. Additionally, maintaining good hygiene, getting the flu vaccine, and seeking medical care at the first signs of respiratory illness can help prevent the spread of pneumonia. Conclusion: Cokie Roberts' life and death serve as a reminder of how fragile life can be and how pneumonia, often underestimated, can strike with devastating consequences. Despite her strength, resilience, and success in the public eye, she was not immune to the dangers of this common but deadly disease. Her story underscores the importance of early detection, treatment, and prevention of pneumonia, particularly for those who are most at risk. Cokie Roberts' legacy will continue to inspire future generations of journalists and women in media, but her passing also serves as a call to action, to prioritize health, seek medical care when needed, and remain vigilant against illnesses that can take us by surprise. This story brings together Cokie Roberts' life, her battle with pneumonia, and the broader implications of the disease, making it not just a tribute to her legacy, but a reminder of the ongoing health challenges many face. Now, here is another recent case of pneumonia. Barbie Hsu, a beloved Taiwanese actress and singer, tragically passed away at the age of 46 after battling pneumonia. Her death sent shockwaves through her fans and the entertainment industry, with many mourning the loss of a star who had captivated audiences for decades. The life and lifestyle of Barbie Hsu. Born on October 6, 1976, Barbie Hsu rose to fame in the late 1990s as a member of the girl group A Sauce and later as an actress in popular TV dramas like Meteor Garden. Her portrayal of Shanghai in the iconic Taiwanese drama catapulted her to stardom, making her a household name not just in Taiwan but across Asia. Barbie's beauty, charisma, and acting skills made her a role model for many young women. As she transitioned from acting to a more private life, Barbie still maintained a public presence, from endorsing various brands to occasionally making TV appearances. She also became known for her outspoken views on beauty standards, health, and wellness, offering advice on maintaining a healthy lifestyle, causes, and contributing factors. Though Barbie's death from pneumonia shocked the world, many close to her noted that her lifestyle in the years prior had contributed to a weakened immune system. Over the last decade, Barbie had been open about the toll her work and personal life had taken on her body. The constant pressure of public appearances, long hours, and stress eventually took a toll on her health. In the months leading up to her passing, Barbie had been struggling with severe fatigue and respiratory issues. Though she had kept these concerns largely out of the public eye, she had suffered from multiple respiratory infections over the past few years, likely linked to the harsh demands of her career and her stress levels, which affected her immune system. Additionally, Barbie's diet and sleep patterns, which she admitted were often inconsistent due to her busy schedule, might have made her more vulnerable to infections. A lack of proper rest and a poor diet can lead to a weakened immune system, making it harder to fight off illnesses like pneumonia. Her family and close friends speculated that the combination of factors, long periods of work stress, irregular lifestyle choices, and the physical toll of her profession made her more susceptible to developing a severe respiratory infection, which ultimately led to her untimely death. The tragic impact of pneumonia. Pneumonia is a serious lung infection that can be fatal, especially for individuals with compromised immune systems. While it is treatable with antibiotics and other medical interventions, the severity of pneumonia can quickly escalate, particularly in individuals who are already weakened by other health issues. What is pneumonia? Pneumonia is a serious lung infection that causes inflammation of the air sacs alveoli in the lungs. These air sacs can fill with fluid or pus, making it difficult for the body to get enough oxygen. As a result, pneumonia can interfere with breathing and lead to a variety of complications if not treated promptly. The infection can be caused by several different types of microorganisms, including bacteria, viruses, fungi, or even parasites. In some cases, pneumonia can also be caused by inhaling foreign substances such as food, liquid, or vomit. It can range from mild to life-threatening, depending on the severity of the infection, the individual's overall health, and other complicating factors. Types of pneumonia. There are several types of pneumonia, and the treatment approach may vary depending on the type and the underlying cause. Bacterial pneumonia. This is one of the most common types of pneumonia and is often caused by Streptococcus pneumoniae, the pneumococcus bacteria. Other bacteria that can cause pneumonia include Haemophilus influenzae, Staphylococcus aureus, and Legionella. Symptoms can be severe and can develop suddenly. It often leads to high fever, chills, chest pain, and productive cough with thick yellow or green sputum. Community-acquired pneumonia (CAP) refers to pneumonia contracted outside a hospital or healthcare setting. It's the most common type. Hospital-acquired pneumonia (HAP), which occurs during a hospital stay, can be more difficult to treat due to antibiotic-resistant bacteria. Viral pneumonia. Viruses are another common cause of pneumonia, especially in children and older adults. The flu virus influenza is a major cause, and other viruses like respiratory syncytial virus (RSV), coronavirus, and rhinovirus can also cause pneumonia. Viral pneumonia typically causes symptoms similar to bacterial pneumonia, but may be less severe. The cough is often dry without mucus in viral pneumonia, and it may take longer for symptoms to improve. COVID-19, caused by the SARS-CoV-2 virus, has brought significant attention to viral pneumonia in recent years. It can lead to severe complications, including acute respiratory distress syndrome (ARDS), and can be fatal. Fungal pneumonia. Fungal pneumonia is less common but can occur in individuals with weakened immune systems, such as those with HIV or AIDS, cancer patients, or those taking immunosuppressive drugs. Fungi that can cause pneumonia include Histoplasma, coccidioids, and Cryptococcus. Fungal pneumonia can be contracted by inhaling fungal spores in contaminated environments, such as caves or areas with certain soil types. Aspiration pneumonia. This type of pneumonia occurs when food, liquid, or vomit is inhaled into the lungs, leading to infection. It is particularly common in individuals with difficulty swallowing, such as the elderly or those with neurological disorders like Parkinson's disease. Aspiration pneumonia is often caused by a mix of bacteria from the mouth, including anaerobic bacteria, which can be more difficult to treat with standard antibiotics. Causes and risk factors. Pneumonia can be caused by various pathogens, and the risk factors for developing pneumonia vary depending on the individual's age, health status, and lifestyle. Key risk factors include age. The very young and elderly are at greater risk for pneumonia. In children under the age of 2 and adults over the age of 65, the immune system is often weaker, making it harder to fight infections. Weakened immune system. Conditions that weaken the immune system, such as HIV or AIDS, cancer treatments, chemotherapy, organ transplants, and long-term use of medications like steroids, increase the likelihood of developing pneumonia. Chronic health conditions. People with chronic respiratory conditions such as asthma, COPD, chronic obstructive pulmonary disease, or heart disease are at greater risk for pneumonia. Conditions that affect the immune system, like diabetes and kidney disease, can also increase the risk. Smoking. Smoking damages the lungs and weakens the respiratory system's ability to fight infections. Smokers are more likely to develop pneumonia and experience more severe symptoms. Environmental factors. Pneumonia can be contracted in specific environments, such as crowded places, hospitals, or nursing homes, where the risk of infection is higher. Exposure to environmental pollutants or chemicals can also contribute to respiratory issues. Previous respiratory infections. If an individual has had a recent cold, flu, or upper respiratory infection, the body may be more vulnerable to developing pneumonia. Poor nutrition. A diet lacking in essential nutrients can weaken the immune system, making the body more susceptible to infections like pneumonia. Symptoms of pneumonia. The symptoms of pneumonia can vary depending on the cause, the individual's overall health, and the severity of the infection. Common symptoms include cough. The cough can be dry in viral pneumonia or productive with mucus or phlegm in bacterial pneumonia. Chest pain. Pain when breathing or coughing can occur due to inflammation in the lung tissue. Fever. A high fever is common, especially with bacterial pneumonia. Chills. Often accompanying fever, chills can be intense and lead to shivering. Fatigue. General weakness and tiredness that can be severe enough to limit daily activities. Difficulty breathing. Shortness of breath or rapid breathing can indicate severe infection, especially if the air sacs in the lungs are filled with fluid or pus. Confusion. In older adults, confusion or disorientation can sometimes be one of the first signs of pneumonia, as the infection can impact brain function. Sweating. Profuse sweating, often following the fever and chills. It is important to note that not everyone with pneumonia will have all these symptoms. And in some cases, symptoms can be mild and mistaken for a common cold or flu. Diagnosis and testing. To diagnose pneumonia, healthcare providers will typically perform a physical examination, listen to the lungs with a stethoscope to check for abnormal lung sounds, and ask about symptoms. In addition to the physical exam, diagnostic tests may include chest X-ray. This is used to confirm the presence of infection in the lungs and to determine the extent of the pneumonia. Blood tests. These can identify whether the pneumonia is bacterial or viral, and check for any complications such as sepsis. Sputum culture. A sample of mucus sputum is taken from the lungs to identify the specific bacteria or virus causing the infection. Pulse oximetry. This test measures the oxygen levels in the blood, which can be reduced in severe pneumonia cases. Treatment of pneumonia. The treatment for pneumonia depends on the type of infection and the individual's overall health. Antibiotics. If the pneumonia is bacterial, antibiotics are the primary treatment. Different antibiotics may be prescribed depending on the specific bacteria involved. For hospitalized patients with severe pneumonia, intravenous antibiotics may be needed. Antiviral medications. If the pneumonia is caused by a virus, antiviral medications may be prescribed, though they are only effective for specific types of viral pneumonia, for example, influenza, COVID-19. Antifungal medications. For fungal pneumonia, antifungal drugs are necessary, especially in immunocompromised individuals. Supportive care. In addition to medications, supportive care can help the body recover. This may include oxygen therapy to help with breathing, pain relievers to reduce chest pain and fever, and hydration to help thin mucus. Hospitalization. Some cases of pneumonia, particularly in the elderly or those with underlying health conditions, may require hospitalization for more intensive treatment. This can include mechanical ventilation if breathing becomes too difficult. Prevention of pneumonia. While pneumonia can occur unexpectedly, there are ways to reduce the risk of contracting it. Vaccination. The pneumococcal vaccine is highly recommended for children, older adults, and individuals with compromised immune systems. The flu vaccine can also help prevent viral pneumonia, particularly when the flu virus leads to secondary bacterial pneumonia. Good hygiene. Washing hands regularly and avoiding close contact with people who have respiratory infections can help prevent pneumonia. Healthy lifestyle. Maintaining a healthy diet, regular exercise, and avoiding smoking can strengthen the immune system and lower the risk of infections. Avoiding exposure. Limit exposure to secondhand smoke, pollution, and other respiratory irritants. Conclusion. Pneumonia is a serious respiratory infection that can affect people of all ages. Though it is especially dangerous for young children, the elderly, and those with weakened immune systems. Understanding its causes, symptoms, risks, and treatments can help individuals protect themselves and seek early intervention when needed. The disease is one of the leading causes of death worldwide, but with prompt medical treatment, many people recover and live healthy lives. Awareness, prevention, and appropriate medical care are key in reducing the burden of pneumonia.
Thanks for watching. Do check back at Vital Sphere.